Good morning and good afternoon, everybody. This is Rich Killewald with the American Cancer Society, and welcome back to the final of the 3 sessions in the COVID-19 and Cancer Echo Series for Cancer Caregivers. Just a couple quick announcements before we get started today. Our expert faculty will again be answering your questions live, so please utilize the Q&A portal throughout today's session to submit your questions. Depending on how you join today, that might be in the black Zoom bar at the bottom of your screen, or if you've joined by mobile, tap your screen and it might show up at the bottom or the top. Please do feel free to submit questions throughout today's session. So as you might be aware by now, all echoes do take place on the Zoom platform. You are able to review Zoom's privacy policy at zoom.us/privacy. And a reminder that this echo will be recorded and the slides and the recording will be shared in a follow-up email within the next week or so. So with that said, I'd like to hand it over to our facilitator for the series, Dawn Wyattrek. Dawn is our Interim Senior Vice President of Patient and Caregiver Support. Dawn?
Yes, thanks, Rich. So let's you go to the next slide with the agenda. Thanks. So first of all, I'd like to welcome everyone. If this is your first time joining us, we hope that you find the information that you're looking for as caregivers or patients. And if you've joined us before, well, welcome back. We're glad that you are finding this information valuable. I want to just quickly go over our agenda for today. We use a pretty standard agenda for each of our sessions. We'll start with our introductions. Then we'll have some brief presentations by our expert panel, who today will be sharing about resources that are available to caregivers from each of their organizations and affiliated organizations. We'll move into a question and answer period, and then we do a brief wrap up and talk about sort of where we're headed in the future. We can go on to our next slide, and I'll jump into our panel introductions. Today we have with us Dr. Allison Applebaum, who is an assistant attending psychologist in the Department of Psychiatry and Behavioral Sciences at Memorial Sloan Kettering Cancer Center. And she's an assistant professor of psychology and psychiatry at Weill Cornell Medical College. She's the founding Caregivers Clinic at MSK, housed in the Counseling Center. The Caregivers Clinic is the first of its kind and provides comprehensive psychosocial care to family members and friends of patients who experience significant distress and burden as a result of their caregiving role. We also have with us today Rachel Kennedy. Rachel is the American Cancer Society's Strategic Director of Cancer Caregiver Support, where she serves as the knowledge expert for the Society's caregiver initiatives and activities. She's responsible for developing a nationwide strategic framework for coordinating, communicating, and integrating interdisciplinary and interorganizational cancer caregiver research and program dissemination and implementation. We also have with us Teresa Franco. Teresa is Vice President of Cancer Center Clinical Operations at the Fred and Pamela Buffett Cancer Center, Diagnostic Imaging and Pharmacy Services across the Nebraska Medicine University of Nebraska Medical Center enterprise. She's responsible for the comprehensive management of cancer care, including medical, surgical, and radiation oncology in both inpatient and ambulatory environments. She is a member of the National Comprehensive Cancer Network, NCCN's Board of Directors and Best Practices Committee, the American Cancer Society Board of Directors, and the Nebraska Cancer Coalition Board. And we also have joining us Dr. Len Lichtenfeld. And Dr. Lichtenfeld, I'm not sure if he's been able to join yet, but he will be joining later on during the presentation. Dr. Lichtenfeld serves as the Deputy Chief Medical Officer for the American Cancer Society at its global headquarters in Atlanta. Dr. Lichtenfeld joined the Society in 2001 as a medical editor, and in 2002 assumed responsibility for managing the newly created Cancer Control Sciences Department. In 2014, Dr. Lichtenfeld joined the Office of the Chief Medical Officer as the Deputy Chief Medical Officer, where he provides extensive support to a number of society colleagues and activities. Dr. Lichtenfeld is a board-certified medical oncologist and internist who has been a practicing physician for over 19 years and is engaged in healthcare policy on a local, state, and national level. All right, with that, I will turn this over to our first presenter, who is Rachel Kennedy from the American Cancer Society.
Thanks, Dawn. Welcome back, everybody, for those of you who are returning, and also welcome for the first time if this is your first time being able to join us. Today, I wanted to share with you guys a little bit about what we're doing at the American Cancer Society around caregiver support. Next slide. So back when I joined the American Cancer Society 20 years ago, it'll be 20 years next month, I started in our research department where I led one of the largest nationwide longitudinal studies of caregiver quality of life, as well as survivors. And so we followed the same dyad of survivors and caregivers for about 9 years post-diagnosis to assess how quality of life changes over time. So much data and publication has come from those studies, and I still continue to do that. And so when I was able to hop over to cancer control, which is the program implementation, dissemination side of the house, if you will, I was able to really apply all of that evidence base to create a solid foundation to establish a caregiver support program. So the strategy around which we develop all of our resources and support in the program is through that assessment of needs that caregivers have expressed, and we've then developed information and support to meet those needs. And what we've found that really has resonated in that research is that caregivers experience a very high level of psychosocial distress. They feel lost in the healthcare system because a lot of times they are not the charted patient. So a lot of times those medical appointments are really assessing the need of the patient and not necessarily the caregiver. They have a lack of medical training. A lot of us are just, we come home with our loved one who's had cancer and we have no clue how to drain a Jackson Pratt drain or how to change bandages. So there's truly this feeling of insecurity around that. They experience poor physical health because they don't have time to take care of themselves. There's social isolation, even in now we know that even more, than ever with COVID around, but caregivers particularly feel isolated socially. They also experience a fear of recurrence. There's some research to show that the level of fear of recurrence that caregivers feel is even higher than that of the patient. So this is a critical thing that we've tried to address. And then also there's those work and financial concerns. And you'll look at that image in the middle. Caregivers are in a perpetual state of juggling roles and responsibilities. So this is really the things that we've based the caregiver support program strategy around. Next slide. So what I'm going to do today is I'm going to share with you guys some resources that we've developed through the program, and they will apply to your caregiving experience now. However, because we're in the infancy of understanding really about COVID-19 and how we can create more pointed, more targeted resources around that, we haven't done that yet. We do have information on caregiving in COVID as we've presented in the first and second sessions, and that information can be found at cancer.org on our homepage. But today I'm going to present to you around the more general resources that we have. And the first one being the Caregiver Resource Guide. This is a very comprehensive guide. It's about 130 pages, and if you've ever seen it and felt it, it's a beautifully constructed material, and it's actually kind of a notebook that has really been a supportive informational piece for caregivers. If you'll go to the next slide, please. So it's a tabbed guide, and each of these 8 sections includes information for each of the headers. So the first section is around cancer caregiving. We actually, we start with the question, what is a caregiver? A lot of people have a hard time really associating with that term and really being aligned with, feeling like, no, that's my husband or that's my mother. I'm not necessarily their caregiver. So really trying to get them to understand that role that they're playing is caregiver. Also, caregiver self-care. This is a critically important section. It talks about nutrition and physical activity. It talks about screening guidelines. And it also talks about really taking time for yourself to keep yourself re-energized and recharged throughout the care experience. Communication is another one that's a big deal that we've addressed around specifically not only communication within the dyad of patient and caregiver, but also with the medical community. The fourth section is around cancer information. Again, we start at a rudimentary level here. The first question in that section is, what is cancer? So we really break down, the description of how cancer cells develop, and then also solid tumor staging and whatnot. The fifth section is around cancer treatment. We hit the high points of chemo, radiation, surgery, and other types of treatment. and also talk about those side effects from treatments. And then patient nutrition is also a very, very important issue, especially when we come around to thinking about the treatment side effects and symptoms. Coping is one that is particularly near and dear to my heart, as this is really the psychosocial content that we address in the guide around anxiety, depression, fear, anger, guilt, not only within helping your loved one cope with those, but also as a caregiver, how do we help ourselves and cope with those issues. And then the caregiver resources, not only do we touch on what we offer at the American Cancer Society, but we also look at more general resources externally. This guide is available at cancer.org/caregiver guide. There's an abbreviated version of it that you can click through, and there's also a full PDF to download. If you'd like a free copy of it, you can call our 800 number there at the bottom. Next slide. So another piece that kind of came out of all of the data from the National Quality of Life Survey for Caregivers study is looking at how we can address those medical unmet needs of caregivers, and also the psychosocial piece of it too. So we created, again, an evidence-informed series, the Caregiver Support Video Series, which can be linked to here at cancer.org/caregiver videos. This is a series of 16 skill-based videos in each of these 3 sections around caregiver self-care, physical care training, and then advocacy. And then we also have 2 caregiver stories that are a little bit longer. It really like humanizes the series and really brings in that perspective of connection with someone else's story. So this series has, we launched it in full last November. We've been launching it in pieces, but last November was when we did a major promotion of it. And there's some exceptional content within this. You'll see Dr. Allison Applebaum has also done a number of these videos. She's been a great resource, and her expertise has been phenomenal in this. So please go check it out and refer it to your friends as well. Next slide. So we also have a web page that's always been our go-to at cancer.org/caregiver. And this is where you'll find all of the resources that I've just mentioned, the Caregiver Resource Guide, that interactive piece of the guide, and then also the Caregiver Support Video Series. But then in addition to that, you'll find more detailed information around managing treatment side effects, navigating FMLA, the ever-changing FMLA, especially now. Also managing financial and insurance issues, tips on how to coordinate care. Also those end-of-life pieces that sometimes we are really in a resource need for those. And so end-of-life bereavement, advanced care directives, all of that information. Also caring for a child with cancer, which is critically important. And then we also have our online support opportunities that you can click to direct from cancer.org/caregiver. Next slide. So another big piece of what we do in our resource, or the suite of resources that we offer through the Caregiver Support Program, is promotion of these books. I mean, books have always been a highlight of what we've done at the American Cancer Society, because there's such rich information in each of these books. So there are 5 of them that are really helpful for caregivers. The first of which is What to Eat During Cancer Treatment. And the second edition of this cookbook was just released last year, I believe. But the neat thing about this cookbook is there's a full section of it in the very beginning that's advice for the caregiver, because more times than not, caregivers are the ones actually preparing the meals for the patients. So there are guides within this cookbook for recipes based on side effect of treatment. So if somebody has a sore mouth, or they're experiencing nausea or diarrhea, there's a color-coded index within the cookbook that actually tells you what recipes are best for those symptoms. It's absolutely genius. It's one of our top-selling resources and books ever, actually. So, and the recipes are spot on. I've actually cooked a number of them at home just for me, just to test them out, and they're delicious. Also, Cancer Caregiving A to Z is another comprehensive resource, along with that complete guide to family caregiving. These are 2 very companion pieced materials that have been extremely helpful for a number of my family members and friends who are providing care to loved ones with cancer. And then also you have, if you're providing care to a friend, how to help your friend with cancer. And then something that's a little bit more specific to the family is Cancer in Our Families. So these 5 books can all be searched at cancer.org/bookstore. Even if you just go in and type the keyword caregiving, these should come up. Next slide. So another online resource that we have is a Cancer Survivors Network, which is csn.cancer.org. It was launched in 2000, and it's the largest peer support community for cancer survivors and caregivers. There are currently 26 cancer-specific forums within there, and then 15 others with discussions for caregivers. And I'll tell you, a few years ago, some of my colleagues in our research department did an evaluation of who comes back and returns to CSN mostly, and the top 3 of those caregivers were in the top 3. So you can actually go in, and I love this platform. While we are working to update the interface of it, these discussion boards and chat rooms are just rich with information around practical problem solving, and caregivers are all about that. And you know, you'll go in and people will have a good day one day and be rejoicing and having gratitude in that experience, and then also come for support in places where they might have low points. Next slide. So really the objectives of our Cancer Survivors Network are to encourage mutual support and self-expression, to facilitate exchange of experiences and practical information, also to decrease feelings of that social isolation, which is always so prevalent in caregiving. And then lastly, to increase feelings of belonging and community. And CSN over the years, now 20 years, has been able to make that happen and to maintain this core group for so long. Next slide. So the last slide that I'm going to talk about is it's an online resource called Springboard Beyond Cancer, and there's a caregiver piece of it this traditionally was created for cancer survivors, but we've added a caregiver module, and it can be found at survivorship.cancer.gov. And this is a collaboration that we did with the National Cancer Institute about 2 years ago, and really it is a platform where you can create personalized action decks and collect information to help better self-manage not only providing care, but your own health as a caregiver. And we include information, again, about being a caregiver, caring for your body and your mind. So this is connecting that physical and mental health piece. The finding meaning and purpose, we tied in a lot around what Dr. Allison Applebaum has done in her practice at Sloan Kettering, and she contributed content to this section around truly finding your role as a caregiver and attaching the meaning and meaning and purpose around that role. And then also we touch on the hard subjects around after treatment ends and that end of life care and bereavement. These are always such critical places where caregivers need support, and they also need to feel empowered to be able to work through this, not only with themselves, but also to learn how to assert help and assert themselves on others, asking for help and support. So far, this is what we've got at the Caregiver Support Program, and we're hopeful that you will use these resources right now and in the future in your care provision experience. Dawn?
Thanks, Rachel. Wonderful resources. Thank you for sharing today.
Mm-hmm.
And we will be moving on to Dr. Applebaum, who will talk to us about resources at Memorial Sloan Kettering Cancer Center.
Hi there, everyone. Good afternoon. Welcome back to all of you who've been joining us for the past few weeks, and a special welcome to those of you who are joining for the first time. Rachel did a phenomenal job in speaking about the many challenges experienced by caregivers and the phenomenal resources of the ACS. And I'm not going to reiterate any of that. I'm just going to take 1 or 2 minutes right now. This is sort of a public service announcement from me. that asking for help and seeking professional support is always a good idea. Specifically, of course, at Memorial Sloan Kettering, where I am, we have several resources specifically for caregivers. We have a caregivers clinic that is staffed by clinical psychologists and psychiatrists, and we provide care individually for couples and families and in groups for caregivers. And these days we're doing this all over the computer, telepsychiatry. We have virtual groups through social work, and we have a volunteer program called the Caregiver Mentoring Program, where we pair current caregivers with those who have been in the role before for additional informal support. I encourage you all who are not Memorial caregivers to reach out to the institution where your loved one is receiving care. There oftentimes are psychologists, psychiatrists, social workers, mental health professionals, really excited to provide support to caregivers, and oftentimes all you need to do is ask. You can find incredible resources, of course, at the American Cancer Society, and also information about providers across the country through the American Psychosocial Oncology Society, acosociety.org, that is listed here. And again, I'm going to probably address this in some of the questions later on, but if you feel like you could benefit from support, you likely will benefit from professional support. That's all I have for now. John?
Great. Yes. Thank you, Allison. And finally, we will hear from Teresa, who will provide us with just a little more information about available resources and updates. And then we will move into our Q&A session. Teresa?
My apologies. Can you hear me now? Yes. I don't want to sound like a broken record, but first of all, good morning or good afternoon, whatever time zone you are in. Either welcome back or welcome for the first time. We're happy that you're interested in these topics and hope that you find the information valuable. Just a couple things. I really do need to reinforce what's already been said. The American Cancer Society has incredible resources that are available 24/7. They are our go-to from a cancer care organization where I care for patients, and we find the information to be very comprehensive and very easy to understand, which is often not the case in some other resources that you might access. So I just can't reinforce that enough. There's really two other things. To reiterate what Allison said, one of the best resources that you can have is reaching out in your own organization. Your healthcare team is your resource, and no question is too silly to ask. So especially at this time when there is so much disruption in your lives, the healthcare team is here to support you. And I would say not only from a standpoint of a phone call, but also if you haven't, and I mentioned this in another one of our presentations earlier, if you haven't signed up for the patient portal that is available in most healthcare systems where you receive care, a lot of good information gets passed out on a very timely basis there. So it would be a missed opportunity on your part to not have that information be available at your fingertips. And then the final resource that I will give to you is from the National Comprehensive Cancer Network, NCCN, which also has a website, www.nccn.org. And if you go to that website, they have a COVID-19 resource tab that's available to you with current information about issues surrounding cancer care and suggestions during this very unpredictable and unusual time. So that's all that I have to offer. Back to you, Dawn.
Thank you, Teresa. Wonderful. Again, thank you to our panelists for sharing those phenomenal resources. And we'll have all that information available for you as well. And we'll be able to share the slides as well. So you will have access to all of the great links and resources that were talked about today. We'll get that information out after our discussion today. So we're going to be moving on to our question and answer period. And again, we have on our panel, we have Dr. Applebaum, we have from Memorial Sloan Kettering, Rachel Kennedy from the American Cancer Society, Teresa Franco from Nebraska Medicine, and Dr. Lichtenfeld from the American Cancer Society. And we will start with our first question that was submitted by our participants today. Are cancer survivors more at risk because they had a compromised immune system in the past? And I'm assuming they mean more at risk for COVID-19, more at risk for the negative potential outcomes of that illness. So I'm going to turn this to the panel. And perhaps I'll start with Dr. Lichtenfeld, who is, I believe, joined us, and ask if you have thoughts you would like to share on this question.
Thanks, Dawn. I appreciate it. And thank you, everyone, for joining us today. And it's a pleasure to be with you. This is a critically important question, and the data is beginning to come in. And unfortunately, when we look at cancer patients writ large, the impact of COVID has been more severe in most settings. There are some studies that have not shown quite the impact, but the studies that have come out of China have shown that patients with cancer, and including a history of cancer, have a higher degree of risk, particularly if they're in the hospital, if they catch the disease in the hospital. In fact, there was an article that came out late yesterday in JAMA Internal Medicine that in the Chinese experience, it said that patients who with cancer, the only thing they checked was with a history of cancer, that if they had to be hospitalized, they had a 4 times greater incidence of a severe outcome or something happening during the hospitalization, such as intubation. The interesting question is that, there's a lot we know about it being immunocompromised, but there's also a lot we don't know. And the question is, if someone gets an intensive course of cancer therapy, we do expect the patient to be immunocompromised, and we expect that to last for a significant period of time after they've completed their treatment. But there are a lot of patients with cancer who don't get a lot of chemotherapy or don't get intensive chemotherapy. We don't really have a very simple test to follow people over time to tell us what their, quote, immune status is, end quote. So the best advice, and from my perspective, and others seem to be giving similar advice, is that patients with cancer need to be particularly cautious during this time. And that means they do need a lot of attention from families, from caregivers, to keep people safe. And the other thing we have to remember is that patients with cancer tend to be older. And that's another risk factor. And they tend to have other, what we call comorbid or other medical conditions, blood pressure, diabetes, heart disease. So in general, and the Chinese study, by the way, going to a different study out of China, said that they even looked at patients who were 3 years out from their cancer treatment and diagnosis who still had difficulty. So bottom line, as we speak today, best to be cautious, best to take special care, and pay very clear and careful attention to those precautions that we're all now very familiar with. Thank you.
Thank you very much. And yes.
This is Teresa. I would just like to reiterate that to the point that was made, that we don't know what we don't know yet. And as we get farther along into this and studies are starting to emerge about the specific implications for the cancer population, I do encourage people to stay well informed and to make, to have frequent contact with their care team, if the care team, which most of the time would be reaching out to them, but testing is changing and procedures and protocols are changing even as we're sitting here. And so it is important, because as more evidence is coming out, there will be potentially changes to interventions, and really reinforcing the precautions that need to be made on a regular basis by your care providers and your caregivers and yourself is incredibly important.
Great. Thank you. Excellent points. And I just received a text from Rachel letting us know that she has lost power and at her house. And we'll be trying to join via a hotspot on her phone here. So let's go on. We want to move on to question 2. There we go. Thanks, Rich. Can you talk about collective grief and how we can move forward as a culture and society to reimagine the grieving process? I'm going to look to Allison on this one, if you can share some insight.
Just, I want to thank whoever asked this question, because this is such an important question. And I think just the fact that you asked it is a big part of the answer, which is we need to be talking about grief and communicating about grief. Our grief right now, it's really multiply determined. There's loss of life, there's loss of roles, there's loss of employment, there's loss of connection, there's loss of the world that we once knew. And I think that all of these need to be acknowledged. I'm going to start first, of course, with loss of life and grieving for those who are dying in the setting of the COVID pandemic. It is so important that, to the extent that we can, that we engage in our personal traditions of grieving as much as possible. For example, if we observe Jewish roles and rituals, that we engage in Shiva perhaps over Zoom, that we could connect as families over Zoom, that we acknowledge the rites of passage, and that we do everything we can to maintain those traditions. Of course, we need to think more flexibly about what that means. And of course, towards that end, grief is so complicated right now, and I use that word to mean 2 things. It is complicated, and more in a diagnostic term of complicated grief, in that losing a loved one in this setting right now is a traumatic experience, and we need to acknowledge that. So I think the first piece here is that we just need to all be communicating about grief. It needs to become more of our public dialogue. I think historically in this culture in the United States in particular, we do a really good job of brushing grief under the rug, and we need to stop that now. I often speak about grief with my patients using an important metaphor, which is that of an amputation. If someone has a limb amputated, if they have a leg amputated, they're in the hospital for a long time, and then they're in a rehabilitation facility for a long time. It's very obvious that there's been a change. When we lose someone we love, a part of our soul has been amputated. And that's not necessarily something that someone can physically see in us or on us, and yet it is perhaps the most tremendous amputation that we'll ever experience. And so we need to put words to this amputation when it happens to ourselves and to those in our communities and those we love. I think really it's important that we speak really openly about this. We speak with our employers about it. And we just acknowledge that grief is becoming a very prominent component of our daily life. It's all around us.
Great. Thank you for sharing on such a critical question right now. I think that is such an important issue that we need to stay aware of. I'm going to ask the rest of the panel any other comments before I move on to question 3.
Dawn, if I may, one of the things that's been very obvious to all of us about COVID is that grief is very personal, and I suspect many of us have gone through something with regard to COVID along the lines that Allison was talking about. One of the things that concerns me, and Allison, I don't know if you want to make a comment on this, is the question, is the fact that we've seen so many pictures of so many incredibly difficult and disturbing scenes around the world. Do we, how do we, what happens to us? What happens to us as a society when so much many terrible things are happening? What's the risk we face as caregivers to becoming inured or used to it because we're getting bombarded with these images that are so fundamentally disturbing?
Yeah, this is such an important point. I'm going to be vulnerable and use myself as an example, because obviously I am a psychotherapist, clinical psychologist, and researcher. And for the past 9 weeks, I've done a lot of work in supporting folks on the front lines who are with patients at end of life and who are dying due to COVID, and I'm supporting families who are separated from their loved ones. And I notice I've noticed in the past month myself feeling just a little more on edge, a little more fatigued, and sort of these sort of weird feelings that, well, not weird feelings, but I'm noticing I'm being impacted. And sometimes I don't truly in the moment identify the feelings as grief, but when I take a step back, I realize that it is indeed grief. It's this, and grief and quite frankly, the trauma of being exposed either primarily or secondarily from afar to these images and these experiences. And so I think this is a time when we need to not only be speaking about grief, but also talking again more openly and prominently about care for ourselves and what that means. And that might mean taking extra time every day to reflect on how we're feeling. It might mean maybe not being able to work as much as we once did, or it might mean needing this professional support I mentioned before. I think this is the first step. We need to talk about what it's like to be witnessing this, whether it's ourselves on the front lines or through the media or through what we just hear from our friends during a Zoom chat. I think we actually need to talk about how hard this is to continually be bombarded by these issues and these images.
Thank you.
Thank you for that. Those were great follow-up questions, and thank you for the response as well, Allison. So let's move on to question 3. What type of cancer treatment has been most affected, I guess, in terms of the patients receiving it and the impact by COVID-19 and the coronavirus? Let's see, who wants to tackle that one?
Teresa, why don't you start with that?
I can start, and then Dr. Lichtenfeld can add. You know, looking at this question, it occurred to me that all cancer treatment has been affected. Right. Whether you are in a surveillance mode or in active treatment, you know, a survivor, you've all been affected by this COVID-19 disruption. And you've been affected in different ways. The fundamental similarities are all about protection and precautions and safety. You know, as we talked about in one of the earlier seminars, people who are in active treatment, in dialogue with their care team and in consultation with their care team, can either be recommended to stay the course. They may have some changes in their therapy plan from a standpoint of how often they are coming for a treatment. They may see some changes from an infusion, an IV infusion, to an oral chemotherapy. They may see some changes in their radiation therapy schedule. So those things can happen as a result of the stage and the acuity of the cancer and your treatment at the moment. And obviously the blood cancers such as lymphoma and leukemia, multiple myeloma, because they have a direct effect on the, have irregularities in the ability of immune cells to act to fight infection, are typically at a higher risk. We talked about lung cancer patients because of the respiratory or breathing issues that are affiliated with COVID-19. And then obviously, to Dr. Lichtenfeld's point, if you have a comorbidity or you're elderly, you also can be more affected from a standpoint of what happens. I think the other thing is too, is that we're also finding that telehealth visits, as you well know, have become much more frequent. So you can expect that that communication that you have with your healthcare team may be different if your scans or your tests may be delayed, or the length in between them increased as a result of this going on, with absolutely no implications for your safety. So once again, another plug for the healthcare team and recommendations there. And also, if you were scheduled for a surgical procedure, almost all health organizations in the country have put into place guidelines or requirements for who is going to get surgery in a quick and urgent manner versus a delay because it is not a emergent, urgent, or time-sensitive matter.
Great,
So
thank you.
if I can add to that, we've seen impacts going from the very beginning on cancer care across the spectrum, including in cancer screening. I think to the point that Teresa made, the American Cancer Society made a recommendation that elective or screenings for people at average risk, not people at high risk, but people at average risk, be delayed until a later date. And we're beginning to move into that later date and trying to put together guidances for when screening can resume. And frankly, it's complex because in some parts of the country are under one circumstance and other parts of the country under a different circumstance. And we've done surveys. We have both information from our call center. 80% of the calls, and now it's maybe a little bit less, but for the first month and a half, 80% of the calls coming to our call center were from patients with concerns about COVID-19. And a lot of them had to do with treatment delays or treatment cessation. We actually got phone calls from people who are in the midst of radiation therapy and some who are planning to get surgery where those operations were canceled, and all sorts of anecdotes that I could share, but probably I don't think time permits. Certainly what happened here, there was, in the beginning, it was a lot of what I call ad hoc decision making. That is, try to determine who the most people are in the most acute need. And as Teresa already mentioned, patients with acute leukemia and lymphoma who have rapidly progressive disease are at that end of the spectrum. And on the other hand, we've seen adjustments made. So a woman comes in with an early stage non-invasive breast cancer, a DCIS, and it's small and it's been biopsied. They may be put on hormonal types of treatments as opposed to going traditionally to surgery and then radiation. So the good news is that we've learned as we've gone along. And we've learned, organizations have come together, some standards have been set, some expectations, for example, in breast cancer, what is something that has to be done right away versus a situation that can wait for a longer period of time. And it's going to be very interesting how we get back to quote unquote normal, because we will not get back to normal. And as already been mentioned, we're going to be doing medicine that we need to do that's probably based on good evidence. We may not be doing all the things that some of us would like to do. And that includes like to do among clinicians, patients, caregivers, the things we would like to have done. Maybe those scans won't be done. And we're going to learn in screening, for example, that maybe a home stool test may be the thing we need to do presently until colonoscopy gets resolved. I think we will see a large increase in the number of patients being diagnosed and treated with cancer once things start to move back to normal. And it's critically important that as we come back into the process, that we make sure that people who are the highest priority, the highest need, no matter what community they live in or where they live, that those folks get the treatment promptly. For some of us, it may mean instead of getting a mammogram every year, maybe it's going to be every other year. Maybe this year it's going to be a stool test for occult blood instead of a colonoscopy. Those are adjustments that need to be made. And it's really important, as has been mentioned several times, keeping in touch with your care team and having them help you make the decisions that are right for you in your community based on your situation, your risk factors is really important. Having that communication goes two ways, maintaining open lines to the care team and having the care team have an open line to you so you can have those discussions, particularly if you're under treatment, is probably one of the most critical parts of this entire process.
Thank you. Excellent points. And can we move on to question 4? And I just wanted to point out, Rachel has been able to join back by phone. So she will be able to join into the answering of the questions. So let's move on to question 4. What are various ways we continue to show compassion to families while we need to maintain physical barriers due to COVID-19? Oh, this is a tough one. Let's see, who wants to take this one first?
I can start. This is a conversation that I've been having with caregivers in a clinic for years, particularly caregivers of patients who who are going through stem cell transplantations and those doing it in the homebound setting. You know, I think one of the things that is most helpful here is actually, if you are the caregiver and you're so desperately, of course, wanting to give the patient a hug and be in physical contact, ask that patient, ask your family member, ask your loved one, what is it you need from me in order to feel love? What is it from me that you need in order to feel connected? Because while, of course, physical touch and being physically close is always a beautiful thing, perhaps there's other ways in which we could achieve that. And I think that's very personal and unique to each one of us. Of course, I encourage you to depend on technology here or use technology more. Families I'm working with are having Netflix parties and watching videos on demand at the same time and sort of joining in together. But I think the big piece here is actually asking specifically what it is that you can do to maintain connectedness and even intimacy without actually being physically close.
Great, thank you. Did anyone else want to follow up? Rachel, did you have any thoughts on this one?
Yeah, just confirm you can hear me.
Yes, I can hear you. You're good.
Excellent, excellent. Yes, power has been going out and internet throughout my neighborhood, and it has been quite the exciting morning. So I'm glad that there's another simpler way to join. Yeah, just to reiterate what I presented in the first session 2 weeks ago around caregiving from a distance and being creative and being able to connect in creative ways and thinking outside of the box and just, you know, echoing what Allison just said, finding ways to create, to connect online and everyone starting a movie at the same time and having that banter and discussion throughout, I think is creating that connectivity. And then again, that love language piece. How do you present love to someone and how do you accept it from others? So I echo everything that Allison said there.
Great, thanks, Rachel. Okay, we will move on to question 5. We have about 5 minutes left before we'll have to start closing. So let's see. Question 5 is, please share some tips for helping caregivers cope in the ever-changing and challenging climate. We've certainly heard about some great resources today, but are there any additional tips outside of the resources that you shared that that you might want to pass on to people?
You know, I think the only thing I want to say right here is something that I've shared in each of the prior 2 sessions, which is I think the challenge for caregivers long before COVID came into our lives, the really big task is sitting with uncertainty on a daily basis and developing the capacity to do so. And I think that we've never been more challenged to do so than we are in the present moment. And so my only addition here is to remember to engage in mindfulness practices, things that bring you to the present moment, like, for example, doing some meditation, doing some progressive muscle relaxation, or listening to music with someone you love, something that brings you into the present moment through your 5 senses. Because when we don't have control, when we cannot necessarily predict a certain outcome, the only thing we do have control over is how we face the present moment. And I think this is actually a really important period in time for us to cultivate that skill. So I think it's really a time for us to challenge ourselves with the mindfulness practices.
Right.
Donna, this is Rachel. I'd also add to that, just putting a check on the way that we're coping. You know, we've talked about this before, but are we drinking too much? Are we smoking too much for those of us who smoke? Or what about how are we eating? Are we eating the right things? Are we fueling our body in the way that is going to maximize our energy? Are we taking time to just go outside and take a walk around the block and listen to the birds instead of listening to a podcast? Or a podcast might be great for you, but it's time for just to quiet the mind and to center yourself. So those are really kind of my top 3, top 4.
Wonderful. Thank you.
Can I add something, Dawn?
Absolutely. Yes.
You know, and I'm thinking, you know, go out, don't listen to a podcast, but don't leave our webinar, okay? But that's, you know, I think it's been very helpful. One of the things that just concerns me is what I call dissonance. And dissonance occurs in many different places, including occurs in organizations, but particularly at this point in time, it occurs in messaging. And so, as Allison has pointed out, being a caregiver for someone with cancer is difficult under never good circumstances, but even under the most traditional circumstances. Being a caregiver in this particular point in time, with all of the additional traumas that are occurring to us, loss of jobs, loss of insurance, concern about income, those are serious. I think one of the things and cancer patients and caregivers are incredibly resilient. I hope you can still hear me because we're having internet troubles also. They're incredibly resilient, and they have a tremendous reserve that has always amazed me. And frequently, frequently a very positive move forward attitude filled with hope. Don't lose that, and somehow try even in these difficult circumstances to understand that if you feel like you're getting mixed messages, you're getting mixed messages. That's the reality test. And I can't, from my own perspective, for all of us, and that includes all of us on this call, it's so important to remember that you have to take time for yourself, and you have to take time perhaps to take a walk. Somebody talked about hearing the birds. If you're in a place where you have to be able to hear birds, listen a little bit and take some time and understand this dysfunction, this anomie that you feel, this uncertainty, is something being shared with many people. And don't be afraid to talk about that. And don't feel that because you feel that way that you're inadequate or you're not able to meet the task. We're all in that position today, and it's not easy. But you know, seek the ways you can to help yourself feel better in a moment, to give yourself that time to reflect and understand that what you do as a caregiver particularly is exceptionally important, and also exceptionally at a time like this.
Okay, this is Teresa. Can I just add one thing? Being in the midst of a pretty tough caregiving situation myself right now with someone with cancer, we are resilient, but we also have to give ourselves permission to ask for help, number one. And number two, when someone offers help, instead of what I used to do is create this impression that I got this, I have a little card that I now carry around with me with 4 specific activities that I can give to an individual when they say, how can I help you? What do you need? Are you doing okay? And so this, you know, this sense that we've all got this because we think we're strong and everybody needs us to be that way. Sometimes we just have to have strategies to let other people in.
Great point.
Yes, excellent point. I love that suggestion about having something ready, pre-written, that you know what your priorities are and where you need help. It's easy to get that to somebody. You don't have to feel awkward in asking for help that way. So I'm going to turn this over back over to Rich Killewald, who is going to go to our Q&A portal where we had a couple of live questions come in, and we're going to try to get to at least one of those. So Rich.
Right.
Rich, you're muted.
You're muted.
Of course, I'm the guy who mutes it, right? Okay, sorry everybody. Have you started to see or hear COVID-19 recovery stories and perhaps recovery challenges? And if so, does the support for these individuals differ to what's currently being provided? I'd ask that of Allison, maybe to start.
So I have, in our own clinic here at Memorial, we certainly have had a handful of families where one member has recovered from COVID. And I think that there's really nothing new in terms of challenges. It's just more of an augmentation of the challenges, that there's a heightened concern, a heightened awareness of looking for certain symptoms. And really, I think, again, my message is going to be, I'm sort of saying the same thing over and over again today, but really more support is better. And so these are, we really do need to continue to provide support even once someone has recovered from COVID, because the concerns don't go away. Sort of like when Rachel referenced earlier, fear of recurrence, that fear of recurrence is something that lingers and oftentimes is higher among caregivers of patients with cancer. Those same anxieties are still there. And so I think that this is a time where professional support is probably definitely needed for families who have recovered.
Dr. Len, Teresa, or Rachel?
I don't have any, I don't have anything to add, because from a medical perspective, we're still too early in this to have had patients with cancer, with COVID survival over a period of time. So we will get the answers to that question. I mean, from a medical standpoint, cancer has its own set of debilitating factors. So patients, for example, with lung cancer or spread to the lung, some of them are having difficulty for whatever reason, whether it's a cancer or other medical conditions, may have trouble with their physical functioning. And from a medical standpoint, we do know that COVID does not it's not the flu. It doesn't come, get better, and go on with your business. It has long-lasting repercussions, different in different people, but especially patients with cancer who have organ dysfunction to begin with. What we're starting to see, as you all may well be aware, we're starting to see situations where those dysfunctions are magnified and they don't necessarily get better, at least for a period of time. But once again, we're very early in this process. So we are literally writing the book, and we will continue to write the book, unfortunately, for months and if not longer to come.
Yes. Hey, Rich, this is Dawn, and I just wanted to point out to everybody as well, Dr. Lynn made a great point in saying, we're very early in this, and so there won't be a significant number of people that we can actually study and look at in terms of impact. And I think that's important when you see, when you're reading things online and when you're looking at online resources, to remember to stick with those that are credible. The ones that we received today are that we're going to share with you are great resources that we know are bound in science and are really backed up with scientific data. There's a lot of things out there right now that aren't. And so I just want to remind everybody to be cautious and aware, and things that sound too good to be true typically are. And you always want to make sure that you're looking to credible resources when you're looking for this kind of information.
Absolutely, that's a great point, Dawn. Thank you. Well, with that, I am sorry to say, but we are 1 minute from the end of this ECHO series. This has been great fun over the last 3 weeks. Just want to close with a couple closing thoughts here. One last plug for resources. I just panic looked and I thought I was muted again. One last look at resources again, just overall. For more information on and COVID-19 resources, you can of course visit cancer.org, nccn.org/COVID-19, and cdc.gov. All of these links, like Dawn mentioned before, all of the resources and links that we've discussed today will be sent in a follow-up email within the next week or so. And for more information about what Project ECHO is doing to respond to COVID-19, please join echo.unm.edu/COVID-19. So that said, thank you everybody for joining the COVID-19 and Cancer ECHO series for cancer caregivers, for people who dropped in once or for others who joined all 3 times. This has been fantastic. You're going to receive an email within the next week or so with the recordings and the slides and the resources that were discussed today. We do please continue to ask you to complete the post-survey evaluation. That's going to help let us know what you liked and what you didn't like about the series so that we can make improvements in the future. I do also want to say to look out for future offerings from the American Cancer Society and the National Comprehensive Cancer Network, NCCN, in the summer about how the COVID-19 pandemic is impacting cancer. If you have any questions in the meantime or want to get in touch with anybody, feel free to send those questions to echo@cancer.org. With that said, everybody, thank you so much for a great last couple of weeks. Thanks to our panelists, to our faculty members, and to all of you for joining. And have a great day.
Thanks, Rich.
Thank
Bye,
you.
everyone.
Thank you.